Who is your team? Well, in addition to your family and friends, your healthcare team is a group of providers with special skills to help manage your liver cancer with you. You've heard from or will hear from many examples of your team. These can be doctors, advanced practitioners, which are nurse practitioners and physician assistants. They might be nurses, registered nurses, dietitians, social workers, mental health providers, pharmacists. So these are the individuals that make up your team. For this segment, I really want to emphasize the importance of the fact that there are multiple disciplines coming together for you in the management of your liver cancer. And this term is called the multidisciplinary team, multiple disciplines. And it's been highlighted through other presentations yesterday and today that the fact that the liver cancer is special in that it typically occurs in the background of cirrhosis, which is scarring of the liver. So the liver health is really important, and that's managed by a hepatologist, a liver specialist like myself. And thankfully, there are many treatment options for liver cancer, and those are provided by an interventional radiologist, a surgeon, a radiation oncologist, and a medical oncologist. So it makes sense that a patient, an individual with liver cancer really needs a team made up of multiple specialties. So I'm going to share I just have a few slides because I really want to just have a conversation to go over everything, but I did want to give you an idea of what your team might look like when we meet together to, again, remove some of the mystery. So I'm just going to ask and make sure if you can see my slides.
We can.
Wonderful. Thank you. So I wanted to show this picture because it shows you how many people are involved in your cancer care behind the scenes. You might not see each of these members, but you should know that they are here for you. So this team of providers typically comes together in a room or virtually to discuss your case. We review blood tests, your imaging, your history, medical history. Together, we discuss this, and then we meet with the patient and the family to determine the stage of the cancer, the liver function, and to discuss different treatment options. And I will say one advantage of the COVID era is that we all have a lot more comfort with the virtual collaboration. And even in remote areas, there are pathways to involve these multiple disciplines, even from far away. So that, I think, is one advantage, if there are any, of the COVID era, is that we all meet as a team with multidisciplines, and there can be people that meet with us remotely. You should expect from your team involvement and input from multiple disciplines. You should expect good communication, and you should expect an access to a point person that can help navigate through this process with you. That is what you should expect from your team. So much of the rest of my presentation is really going to focus on this slide, so you can get to know your multidisciplinary team. I'm going to describe the roles of the subspecialties and mention the types of conversations that we might have in our conference, in our meeting, to answer those questions of what is the stage of cancer, what are the treatment options, and how can we optimize cancer care. So other than you in the middle, the nurse or advanced practitioner is really the most important person on your team. They are your point person to help navigate through the sometimes overwhelming journey. They would coordinate appointments, get records, and they really should be only a phone call or an email away. And they're also the person to gain access to those other providers or other members of the team, such as a social worker, a financial expert, dietitian, mental health provider, clinical coordinator. We talked about clinical trials yesterday, a pharmacist or complementary medicine, such as acupuncture, meditation, those types of things. Typically, a nurse or the nurse coordinator can provide access to those other services. On the bottom is a hepatologist, like myself, is a liver specialist. We see patients, and not just liver cancer patients, but all patients with chronic liver disease. Those patients with chronic liver disease like cirrhosis are at risk for liver cancer. So one of my most important roles is to educate and screen patients for liver cancer so that we can detect the cancer at early stages. But if we do have a diagnosis of liver cancer, a hepatologist will assess the liver function with blood tests, an examination, maybe an endoscopy, which is a scope test to look in the food pipe. And this information helps inform the rest of the team what the individual and the liver can tolerate in terms of treatment. And then a hepatologist would see a patient with liver cancer regularly during treatment to continue to assess how well the patient and the liver are tolerating the treatment. And that would be anywhere from 2 to 4 to 6 weeks on treatment. So a hepatologist, I'm here to support the liver and then maximize liver function during cancer treatment. On your team, you have two types of radiologists. One type of radiologist is a diagnostic radiologist. This is an expert in reading and the CAT scans and MRIs that you get. It's really important to have an accurate diagnosis and an accurate staging of the cancer. And these radiologists are very skilled in reading the scans and really ensuring that they think that it's a quality image. So sometimes you might be asked to have additional MRIs or CAT scan. It's really because we want to get the best picture, and so we can have the most information to be the most accurate. And during your cancer treatment, the diagnostic radiologist will help read the follow-up scans to make sure that the cancer is controlled or determine if there's a recurrence. The other type of radiologist is an interventional radiologist. They help us and help you determine whether or not the liver-directed therapies are options. These would be the TACE, the TARES, the ablations that you've heard about during this conference. Their input would determine whether or not these procedures would be an option based on the size, the number of the tumors, and the underlying liver function. And with them, we monitor how patients respond to those treatments, and that again, we would see if there is a recurrence of the cancer and whether or not another procedure like that needs to be performed. Next, we have the surgeon on the bottom right. A surgeon who we'll hear from, it gives us the most input about whether or not surgery or resection is an option to remove just that part of the liver, or if a patient is a transplant candidate. Again, they would help us determine those things based on the size, the location, the anatomy of the liver, Also the performance status, or how well someone can do their daily activities, and based on their other medical problems and laboratory testing. So the types of conversations we would have with the surgeon during that conference of the picture you saw would be, how can we get this person to transplant, or how can we get this person to surgery? How can we optimize other parts of their medical conditions that they might be a candidate for those things? So again, it's a discussion amongst all the providers and the team to see what types of options you have. Next is a medical oncologist. We heard from Dr. Abu-Afla yesterday, and the medical oncologists determine whether or not there is a treatment option for systemic chemotherapy, and those could be pills or IV chemotherapy, and that depends, again, on the liver function, the stage of the cancer, and discussing the side effect profiles and what other symptoms the individual might have. Is that the right option? And then we have a radiation oncologist. There's external beam radiation that can sometimes be considered for liver cancer, and that can also be considered in conjunction with some of the other therapies too. So radiation plus an interventional radiology procedure. So these are the types of things that are discussed during the meeting. Not always, but sometimes a palliative care representative is in the meeting, and this would be helpful for symptom management and also family support as needed. And then a pathologist is often involved in the conference because we look at the tissue under the microscope if a biopsy is performed, and that can sometimes inform how aggressive the tumor is. And also, if a patient does have a liver transplant, we look at the liver that comes out under the microscope to see what the likelihood is that the cancer might return. So this is your team. These are all the people that are here for you. And we know that the multidisciplinary team, based on research and experience, really improves communication. It improves patient-reported symptoms such as anxiety and depression. And when you know you have a team that is working in your best interest and there's good communication and you feel like you have all the opportunities for treatment options, patients have a much more satisfactory experience through their journey. And because this multidisciplinary team improves communication and efficiency, because we're all in the same room, it therefore improves survival. So research, has shown that. So we are here for you. Your team is here for you, and our goals are your goals. I hope I gave you an idea of sort of what happens behind the scenes, who is your team, and the fact that we're here for you, and we should only be a phone call away. So thank you for the opportunity.